My name is Dr. Apolinari Yongangirwa. I'm affiliated with AED Incorporated as a board member and the coordinator of Maruku project. In June 23rd, we arrived here in Bukoba. In June 24th, we visited the Maruku Health Center and we had a guided tour by the clinical in charge. This is like a waiting area, to see the medical doctor or medical assistant, and also for medication and other things. After the tour, we planted 200 trees around the compound of that health center. Since during the construction, there are a lot of tree cutting, so we thought one of the things we can do is at least start improving the environment by planting the trees. June 25th, medical personnel or medical expert in our team of AED Inc. They had their presentation at the Bukoba Regional Hospital. June 26, we had a grand opening of our new built health center at Maruku.
An awesome project by the people of Maruku for the people of Maruku. And though it had provided financial support, the people of Maruku provided 25% of the resources. They volunteered their time, you volunteered your talent, you volunteered material resources, you volunteered manpower, and you volunteered money.
I think what you have demonstrated is what we know about the United States. We know the connection of African-American connection with Africa, and the people like you have demonstrated it so well. And as our friend here said, you are not necessarily too rich as a family, but your hearts are very rich, and we thank you so much for every contribution you have made from 74. So you can see what you have done in this country is quite amazing. You have contributed even more than some of our citizens here. So you better call yourselves Tanzanians and definitely Africans as well. And let me thank again everybody of you for your contribution. I think coming here makes a lot. The friendship which President Kennedy and President Nyerere started a long time ago. And I can tell you, most of us say we have been beneficiaries of the good heart of American people. Myself, I got a scholarship. I studied in North Carolina, North Carolina A&T. So I went to the Black-based college.
Ndugu zetu mnaowaona hapa sio kwamba ni watu matajiri sana, hapana. Na hilo nalisema kwa uhakika kwa sababu hii familia ya Williams, mheshimiwa mgeni rasmi, mimi ninaifahamu binafsi tangu miaka ya 80. Ninawafahamu, sio familia tajiri, lakini ni tajiri wa roho.
Our General Secretary, Mama Elvira Williams, express sincere gratitude for the people of Tanzania, specifically AED Advisory Body Committee in Bukoba in Dar es Salaam.
I would like to go back to 1974 when we first came, Dr. Irving Williams, my husband, to Mwanza, and we worked very cooperatively with the people there. They gave us tremendous support. They were very concerned that my children didn't have the kind of family structure. So my children ended up with lots of families, extended families, with BBs, with grandmothers and grandfathers, and they provided the love and encouragement that we really needed. So much so that as I left, I said, this is my home. Tanzania is my home.
Dr. Francis White, who is a new member of AED board, and first time to visit Tanzania as ambassador of goodwill. She's very excited to be in Tanzania since she has known Tanzania through her work, especially the role of Tanzania in the liberation of Africa's countries which were still under the yoke of colonialism in southern part of Africa.
To have a chance to see the places that I've studied and to know also the role of Tanzania. This I didn't study so much. This was more activism. The role of Tanzania in the liberation of Southern Africa. That is something that I think all Tanzanians can be proud of, and certainly something that I've known about and have a chance to come here and see what kind of country would, what can I say, what kind of country would actually take their own newly won independence and make sure that other countries in Africa could become independent. It's again something that Tanzanians can be very proud of, and I am really honored to be here with people who have had that as part of their legacy.
Dr. Irving Williams, our medical director, spoke and explained in details the impact and role of medical interventions of IED incorporated in various medical institutions in Tanzania.
I came here as a pediatrician. I was fortunate in agreeing with the government of Tanzania to spend 2 years at Bukoba Hospital in Mwanza working as a pediatrician. And after I was there a very short period of time, I was very depressed and upset and concerned because of the number of children that we saw almost every day, 2 or 3 children dying from preventable diseases. During that time, the big 3 of malaria, malnutrition, and measles was very common, and we saw a number of children dying from these diseases, which we felt were preventable. So that after spending the 2 years at Bukoba Hospital, we felt that we would be not doing a good job if we were to go back to where we came from and do nothing. So therefore we decided that we had to do something else. And it was our contention that in order to have good health, one must have good nutrition. Good nutrition requires good agriculture, and education is the change agent for sustainability. We must impart information to mothers and fathers about the care of their children, what's needed in order for all of the children to be able to go to school and survive into adulthood. So what we did once we went back to the U.S., we started the organization AHEAD, Adventures in Health, Education, and Agricultural Development.
Professor Benson Bana Rugimbana expressed heartfelt gratitude to the member of AHEAD Inc. and the people of the United States of America, as well as the government of Tanzania and all the people of Tanzania who have contributed tremendously to the success of this project.
We are quite grateful to the American people through AHEAD Incorporated United States of America who have been instrumental and who have contributed significantly towards the construction of the maternal and pediatric ward, which started in November 2017. Now the building is completed. AHEAD Incorporated United States of America have contributed a total of 225 million shillings towards the construction of this building. The guest of honor assured the visitors that the government will do whatever it takes to make sure that this building is kept clean all the time. The facilities required to provide services are available to make sure they deliver the services that are expected by the people of Maruku.